All right, this week in Grace's Girls Club, we have a very, very special gift, a very special visitor. Meredith Thomas has been one of my oldest friends. I think you've known me since what? I was 12?
Pretty much, I think so. I can't believe it's been that long though.
I can't either. I can't either. However, you're incredibly accomplished. So tell us what you do.
Thank you. So I am a sports physical therapist. So I went to physical therapy school and then pursued a sports specialty as well. And so my focus was primarily in overhead athletes.
Okay, very cool. And walk me through what your day to day looks like with that. What are some of the different patients and the different
Yeah.
athletes and their injuries that you see?
Yeah, so the really fun part about physical therapy is that no patient is ever the same, no case is ever the same. And so over the past few years, I've gotten to work with some pretty cool people and learned so much from them. But typically, beginning of my day starts with a patient coming in, just talking through what's been going on, how they're responding to current treatment, and then going through some exercises with them to help their diagnosis, maybe even doing a little bit of manual therapy as well and just trying to get them back to 100%. And when it comes to physical therapy, like I mentioned, it's really great because you can have such a wide variety of patients. And so, even though I do have this sports specialty and I have worked with many athletes, I also have had the opportunity to work with all sorts of people from all different walks of life. So, it's really fun and there's lots of variety in it.
That's awesome. That's awesome. So, walk me through the letters of STEM: science, technology, engineering, and math. Which letter or letters do you feel like most applies to PT?
Ooh, that's difficult. I definitely think science, technology, and engineering probably apply more. But really, when it comes to physical therapy, maybe I'd lean more towards the engineering side of it just because a lot of physical therapy is problem solving. No patient is the same, no case is the same. And a lot of our new technology we do have to kind of work with and figure out. And so for us, a lot of it is just kind of that deep dive into problem solving.
I love that you said that. I feel like that's an answer probably most people wouldn't expect from your field, but I think it's so true. From my experience with physical therapy, it's not about, what hurts or what isn't working well. It's what connects to that and how do we heal that whole area. So I could totally see how that
Right.
would play into engineering and problem solving.
Yeah, absolutely, for sure.
So I know you talked about your sports specialty, but tell us a little bit about the schooling that you went to and how educationally you got to where you are today.
Absolutely. So I did my undergraduate degree at Mississippi State, and oh yeah, and absolutely loved it. Would not trade it for the world. And so after Mississippi State, I then went on to physical therapy school. So that is a doctorate level program. And so with that, you do go through the whole application process and all of that. And then it is a 3 year straight through program. So you don't really do summer break anymore. We had a little bit of a break, but not what we were used to with college. But you just go straight through, and then within that, you go on what we call rotations. And so after you've hit a certain level of your education throughout that, you're then able to go and start working under a mentor in clinics. And so that is super fun. It is really interesting. And that's really where you get that hands on experience, but all under the supervision of a licensed physical therapist that is teaching you and guiding you along the way. So that was super fun. I really enjoyed that part of it as well. And then after that, I went on and completed a year-long residency program. With physical therapy, residencies are not required. However, there is some talk that maybe they will be in the future. Um, but with that, I was able to go and do a sports residency, and mine was a year long program. Some are a year to a year and a half, and you can do them in such a wide range of areas. So I did sports, but you can even do oncology, lymphedema management, you can do pediatrics. Really, there is no limit. It's amazing.
That's awesome. That's awesome. Well, you are a very, very educated woman, that's for sure.
Thank you. Thank you.
So, walk us through why you chose this career. What stuck out to you about physical therapy?
Yeah. So, do you know, I will never forget the first time I went and shadowed a physical therapist. She was working with an infant, and I was just so surprised. Had no idea that physical therapists did that because most of my friends, that had physical therapy had, back issues or ACL tears. But this woman was working with this baby, and it was just the most fun thing I'd ever seen. You could tell the parents were so joyful she was helping the child. The child was giggling and having such a great time. And the physical therapist was just, I mean, she just lit up. And so when I saw her interacting like that with a patient, I was like, this is what I have to do. I've got to do it. And so that kind of led me into physical therapy as a field in general. And then, of course, growing up with a brother, sports have always kind of been a part of my life. And then, of course, going to Mississippi State, it's really hard not to know baseball. So for me, growing up with baseball being something that was so special to my family, that was really what drove me to go into the sports arena.
Absolutely. So cool. So cool. I love how you blended what you wanted to do to the world, what you saw as an interest, and what you were interested in intellectually. That's awesome. So walk me through what the best part of your job is.
I think it's when you see someone really light up at what they were able to accomplish. And it may be something so simple like getting to walk from point A to point B for the first time after surgery, but seeing their face and how excited they are, it's so rewarding and it's so much fun. So I think it's really just seeing patients make big accomplishments and accomplish these goals and get back to where they want to be in their daily lives.
Yeah, that's amazing. That's amazing. So that was the best part of your day. Walk me through some parts that are a little more difficult. What are some of the issues that
Ooh.
hit your desk or come into the clinic that you have to deal with every day?
Yeah, so I think one of the biggest ones is working on difficult cases, and I don't mean difficult people at all, but just having someone whose case is really specialized and just really a rough diagnosis, and kind of, I think, with that, encouraging them and motivating them, because a lot of times it can be very just devastating, especially for an athlete, to have an injury and go through surgery. And so just keeping that positive mindset can be pretty tough and constantly encouraging them. But I also think that's one thing that I really, as hard as it is, I do enjoy doing, and having to or finding those little goals where they can see their progress really makes the world of difference. And I think that's something that we all kind of do in our daily lives, right? We can kind of get bogged down sometimes with different things, but if we see, we've made this little 1% difference from yesterday to today, and we're 1% better, then you can really start to find more and more encouragement and more of a positive outlook. So I'd say that's probably one of the most difficult things. It's just maintaining that positive perspective and then encouraging those that are having a tough time.
Absolutely. Yeah, I feel like that's so relatable in so many fields. But you know what? If there's any woman for the job to find the silver lining, it would be you.
Thank you. Thank you.
All right,
It's
so
fun
one
for
last
sure.
question. I know how busy you are. I don't want to take up too much of your time, but if you had a message to young girls or young students in general who were interested in joining the STEM force one day, what would your message to them be?
Don't take no for an answer.
Yes,
I think
I
the
love it.
biggest thing, I think the biggest thing for me is, especially being a girl and a girl in sports and a girl that specialized in male dominated sports, being able to say, I can do this and believing it yourself is just, it's so vital. And I'm guilty of not thinking I can do things sometimes and not feeling confident enough. But really just saying, this is the moon and I'm going to shoot for it and I'm not going to settle for less is just so important. And that's something that I really wish I would have been just more adamant about from a younger age. But just knowing that you can do it, and then just always surround yourself with people that believe you can accomplish your goal and believe you can accomplish that dream.
Absolutely. That was poster child, best possible answer. I love that. I wish we could have that printed on a sign for everyone to read.
Thank you.
Well, Meredith, thank you so much for your time today. It was great to get to talk to you. I miss you, girl. But
Absolutely.
thank you
Miss you
so
too.
much for sharing your expertise with us.
Absolutely. Thanks for having me. I really appreciate it.
Have a great day today.
You too.